Now we're beginning our lower body sequence. We've already worked the inguinal lymph nodes on the right side. You want to make sure you have access to the skin on both sides of the leg. We're going to start proximal to the inguinal lymph nodes, the top of the femur, stretching in and down toward those inguinal lymph nodes. Spread your fingers slightly so that you can cover as much territory as necessary. You can do this lying down or seated, whatever's comfortable for you or your client. Remember to work anterior and posterior on the limb before moving distally. 3 to 5 strokes, continuing with the 1, 2, 3 on, 1, 2, 3 off rhythm. Make sure that you take deep belly breaths throughout the sequence to stay relaxed and continue to stimulate the lymph nodes in the belly, which are very helpful for pulling fluid from the legs. Working distally on the leg, anterior and posterior. Now, depending on your client, you may need 3 or more hand placements to cover the whole area of the thigh. It just depends on the size of your client. With a child, you should be able to get your hand around the whole thigh in one hand placement. So just know that front and back is not always cut and dry depending on the size of your limb. Underneath the knee in the popliteal space, you're going to do an in and up motion, a half circle with pressure in and up to stimulate the lymph nodes behind the knee. Working down on the lower leg, stretching in and up toward the anterior knee. Now know that if you're working a specific knee pathology, post-knee replacement, post-knee orthopedic injury, you would pause the DVD here and spend quite a bit of time at the knee. Again, you can treat the knee as its own individual limb and drain every single aspect of the knee, proximal to distal, stretching strokes up toward the inguinal lymph nodes, and you could increase your repetitions 10 or more strokes, whatever's needed in that area. If your knee is your targeted area, however, you do want to open up the area of the thigh before you work the knee. You have to give the fluid somewhere to move, so we need a clear pathway from the knee to the inguinal lymph nodes. Moving down the leg, stretching strokes on the anterior shin and posterior calf. Here you can stimulate the retromalleolar nodes with some small stretching circles. Here we do a general stretching stroke on the foot. But also know if you're working a sprain or strain orthopedic injury on the ankle, you're going to pause the DVD here and spend 10 or more repetitions and stretching strokes at the ankle and the foot. Once you're finished with the foot, you're going to work your way back up distally to proximal on the lower limb. Anterior and posterior of the lower leg. The back of the calf, stretching strokes. Spread your fingers as much as possible to cover as much territory as possible and make your work time efficient. Stimulate the popliteal lymph nodes once more, the popliteal space, continuing on to the back of the thigh, stretching strokes in and down. Also know that it depends on the quality and texture of your patient's skin. That will tell you how much stretch you need to get. You need to take up all the slack in the tissue to get a good stretch. Remember, we're using the minimum amount of pressure necessary to cause a skin stretch. So it's always helpful to take a deep breath. Make sure you're not using too much pressure. We don't want to use any more pressure than is necessary, or we will not be working in the lymphatic system. This is not a muscular massage. And just look above my index finger, you can see the tissue moving and stretching. You really want to see that tissue, that skin stretching and moving. If you're not, you probably need a little bit more pressure. If you're sliding over the skin and not engaging the stretch, you do not have enough pressure. If you're causing redness or discomfort at all, you're using too much pressure. Stretching in and up toward the inguinal lymph nodes to finish. Here you can also sweep the back of the buttock up and around toward the inguinal lymph nodes, depending on your client's comfort with that. Of course, you could have your client positioned differently if they have a hematoma on the hip or thigh, whatever you need to do to target the area. Finish with a general sweep of the whole lower leg up toward the inguinal lymph nodes, finishing by moving fluid from the inguinal lymph nodes toward the abdomen with that stretching oval. Finishing with deep belly breaths, 5 repetitions. Here you can repeat this sequence on the left side of the body. And when you finish the whole sequence, both sides of the body, then you're going to clear the neck once more. Here we're finishing by clearing the neck, moving all the fluid that we've sent from both axillas, both inguinal areas, up through the thoracic duct. We're clearing the face, the head and neck lymph, preparing it to move into the circulatory system. You may want to inform your client they may need to be prepared to feel a little sluggish if their system has been very toxic for a while, if they've been dealing with chemotherapy, general malaise, chronic fatigue. The flushing of these toxins may cause them to feel a bit sluggish after the treatment. Encourage them to drink water. Thank you for taking the time to learn manual lymph drainage for the face and body.